I was diagnosed with ME CFS when I was, I think, 14 or 15 years old. I was in year 10. I had a virus for a couple of weeks. I was feeling very unwell. I went to get all that sort of the blood tests, all the sort of scans and everything to test sort of what was wrong with me. And then when the virus went away, I started feeling very tired still, very sort of just could not do anything. So obviously I went to the hospital. I saw Dr. Kelsall, and she ran me through some tests, and I got diagnosed with CFS ME then. I felt very sort of unwell, so I had sort of fever. I felt very, very tired, as in I literally could not get out of bed sometimes. I felt very unmotivated, so I couldn't do anything with my life at all. I didn't feel like going to school. I didn't feel like playing football, going to the gym, things I love doing. I had sort of stomach bug, so my stomach was hurting all the time. That's why I had loads of tests to check that nothing was wrong there. Sort of started losing concentration, so I literally couldn't focus on anything. I was always sort of looking around. I was getting very distracted. And yeah, other than that, yeah, my body just felt completely wiped out all the time. So I went to the GP. I sort of got all my sort of normal GP related tests done, and then they felt like I needed to go further. So I went to Southampton. I had sort of all the proper tests done. I had blood tests at Christchurch, Bournemouth, Poole, literally one every couple of days, because they wanted to figure it out as soon as possible, because obviously I was very young. And then yeah, basically after a while they then sent me off to get sort of everything checked again at Poole. And then obviously eventually when the virus went, they said to me that it might be something like a fatigue syndrome. So that's when they sent me to the team at Poole. The service helped me a lot actually. I had a lot of sort of different sort of people I went to. I went through sort of different routes to try and sort of figure out what was the best one. And when I found the right route, it sort of just helped very well. I'd go for sessions and we'd just be very relaxed, very chilled out. It made me feel very comfortable to talk about my problems, because I've always quite struggled to do that. Like when I first started going, my mum used to say everything for me. I'd just sit there very awkwardly. So yeah, obviously as we progressed, it sort of helped me sort of learn how to deal with it. It also helped to deal with sort of my anxiety and my depressive symptoms, which I came along. It helped me to sort of just feel like it was okay and everything was very normal, and these things happen. It's not the worst thing in the world to have to go through. So it sort of just made me feel very sort of relaxed about the situation, and sort of helped me move on and sort of just live with it. I still struggle now. I used to play football every single day, pretty much maybe 4 or 5 times a week. Now I probably play it once every couple of weeks, if maybe even that. It was very difficult at the time. Obviously I was very much into it then. I was still playing for my kids' team, I was still playing for school. I was still playing with my friends every weekend or every night after school. So to have to sort of cut down on that was very, very difficult. It was also quite hard because when I'd go to the gym with my friends, they could go to the gym for sort of 2-3 hours. They could go swimming after, they could cycle home after, they'd feel really good, and I'd be in there for an hour and I'd be absolutely done in for the day. And it was very difficult to comprehend what really was going on, because I was so young. I was 15 years old. It was something I never expected. I didn't even know it was a thing. I'd never expected to go through something like that. But obviously after a while you kind of just you live and learn to accept it, and just learn that that's you. At the end of the day, you can't change anything, and you just kind of need to. The key strategies that helped me was basically just being patient with myself. So basically and trying to just live to sort of work with the fact that because I'm very hyperactive, so I literally can't sit still. It made it very hard when I'd sort of try and have my rest periods where I just have to sort of chill out. I would literally just get up every 5 minutes and sort of just walk around my house, and I just really struggled to stay focused. What I tried to tell myself is you can do this for this amount of time. If you feel tired, it's okay. I'd be I can go play football for an hour, but then I have to stop, and I'd have to stop maybe even if it was for 10 minutes, and I could play again. But having these little breaks meant that I could still do what I wanted to do, but also just having that little bit more extra break than maybe the extra person. Say I was playing a football match, I would play a half, I'd come off for half time, and I'd come off for sort of 10-15 minutes. If I felt okay to go on, I'd go back on for the rest of the game, and then I'd rest when I get back. It's sort of I had to take sacrifice. I had to be what do I do? Would I rather play for my football team, or would I rather go and play football with my friends at the park? It was what feels better for me, because realistically I knew I couldn't do it all. especially if it was the same day. So like, I'd be like, let me play the match and let me just rest later. And that's sort of ways that I learnt to deal with it. It will be okay, you know, you will learn to manage it. Like, I don't feel as bad as I did every day when I was 15 years old. Like, I've had it for like 6 years now, and I feel okay most days. You know, I have my moments, like I definitely feel more tired than I would have done. Definitely wake up and I really struggle to get out of bed. That's probably my main weakness still, is I can't just get up and get out of bed. I need to wake up half an hour earlier to wake myself up. But I will just say to people, like I said, it will be okay. Like, you will be okay. Once you've got your right treatment path, once you've figured out what you feel is best, you will start to feel more positive about your day. And just try, like I said, try to stay positive. You know, you may feel a little bit down about it all, but realistically, you will be okay.